Hello.
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 A new survey conducted on behalf of Teva Pharmaceuticals in collaboration with the U.S. Pain Foundation and the American Academy of Pain Management found respondents agreed information and resources are critical for pain management. PainMatters.com is a new resource to help healthcare professionals and people affected by pain. Here to talk about chronic pain and Pain Matters is Paul Gileno, Executive Director, U.S. Pain Foundation, and Dr. Melanie Rosenblatt, Medical Director of Pain Management, North Broward Medical Center. Doctor, why is the treatment of chronic pain so complex?
The treatment of chronic pain is so complex because chronic pain affects so many people. Chronic pain affects more than 100 million Americans. That's more than cancer, diabetes, and heart disease combined. And while prescription pain medication is the mainstay in treatment for this illness, it's also prone to abuse.
Doctor, why do you think discussing abuse is uncomfortable, and what can be done to open a dialogue around this issue?
The survey, which was done by Teva Pharmaceuticals in collaboration with the U.S. Pain Foundation and the American Academy of Pain Management, found that both healthcare providers and people who live with pain want to take responsibility, personal responsibility, for their role in prescription drug abuse. But they also find that they're uncomfortable talking about it. And in the survey, the reasons for that were on the healthcare provider side, they're afraid it'll damage their relationship with the patient. And on the patient side, they're afraid that having the conversation with their doctor will lend their doctor to think they're actually abusing the medication and may have their doctor stop prescribing their medication.
Thank you. Paul, tell us about your experience with chronic pain and what led you to create the U.S. Pain Foundation.
Sure. Well, 12 years ago, I was lifting a box twisting and I broke my back, which severed my sciatic nerve. At the time, I didn't realize it, but I became a person with chronic pain, and that began my chronic pain journey. On that journey, I realized that I needed to become more educated, advocated for, empowered, and informed. So I decided to start the U.S. Pain Foundation with the hopes that other people wouldn't have to go through what I went through.
Thank you. Paul, why are the survey findings so important?
Well, the survey findings are very powerful and important because we realize that both healthcare providers and people with pain are craving for more information and resources on abuse. We realize that we're both taking responsibilities. It's not only the people with pain as well as the healthcare providers. We're both taking responsibility for abuse of prescription pain meds. So between that, we realize that we have to start a conversation, and we need extremely good resources and information, which PainMatters.com brings.
Doctor, what is Pain Matters, and why are resources like this so important?
Pain Matters is a website that has lots of useful information and links, as well as tools like Paul mentioned. It's so important because we can only begin to address the problem if we understand the problem. So there's a critical need for information. Pain Matters provides that information. There's wonderful resources on that website. And really the call to action is to understand what this issue is and understand the role that we all play in this critical issue.
Thank you. Doctor, where can people go for more information on what we discussed here today?
PainMatters.com is the website. There's lots of information on that website.
Thank you. And doctor, what role do you see abuse difference technology playing?
So the FDA recognizes that the introduction of abuse deterrent formulations is vital to addressing prescription drug abuse. And on that website, you'll also find useful video describing what abuse deterrent technology is. And basically what that means is a pill, one of the ways it's abused is it's crushed with a hammer or a coffee grinder, and then it can be snorted or injected, which is not the way the product is intended to be used. So abuse deterrent formulations prevent that from happening or mitigate that risk of abuse so that it's harder to manipulate the medication.
Thank you. Paul, is there anything you'd like to add about chronic pain or Pain Matters?
I think it's important for people with chronic pain to realize they're not alone and that there's great resources out there like PainMatters.com as well as U.S. Pain Foundation to help them on their pain journey.
Thank you. Doctor, is there anything you would like to add?
Yeah, reducing prescription drug abuse is a multifaceted problem, and it's going to take a multifaceted approach to address this. This website has some very important information. I think in order to address the problem, we need to understand the problem, and there are some very powerful tools and solutions on that website.
Thank you. That's all I have for today. I'd like to thank you both for participating in the interview.
Thanks for having us.
Thank you very much.